everyone, welcome to Alacrity Explains Anatomy. Today we're going to be looking at the osteology of the tibia. Now, let's take an introduction. The tibia is the larger, stronger, and the medial bone of the leg. Now, this is the leg, right? And this is the lateral aspect of the leg, and this is the medial aspect of the leg. So this is the tibia. There are two bones in the leg. There is tibia, there is fibula. But in this video, we are looking at the anatomy of the tibia, which is the medial bone of the leg. It is commonly called the shin bone because if you take your hand down and feel your leg, you see that subcutaneously you can feel a very hard structure. That's the tibia. So it's also called the shin bone. It transmits body weight from femur to talus. Remember we said in our lecture on osteology of femur that the femur transmits the body weight from the pelvis or the hip bone to the what? To the tibia. Now the tibia now transmits body weight from the femur to the talus. It articulates with the femur, fibula, and talus. With the femur superiorly, while with the fibula and talus both articulate with the fibula superiorly and the fibula inferiorly, as well as the talus. Side determination. How will you know the right or left tibia? Now the upper end of the tibia is broad with condyles. Look at this image. It has a lateral condyle and it has a medial condyle. And you see how broad it is. The upper end is broad compared to the lower end. So the moment you pick a tibia, you know, first of all, identify the upper end and the lower end. The upper end is broad with condyles. Then there's a tibia tuberosity anteriorly. There's a what? A tibia tuberosity anteriorly. Look at the tibia tuberosity here. This structure here. This is your tibia tuberosity. It is located what? Anteriorly. Then the medial malleolus projects downward medially. Now, the lateral malleolus is not on the tibia. It's on the fibula. So the moment you look at the inferior aspect of the lower aspect of the tibia, you take note of what? The medial malleolus. This is the medial malleolus. See how it's projecting downward. See how it's projecting downward here. So the medial malleolus projects downwards medially. It means you find it on the medial side, while the lateral malleolus, which is on the fibula, you find it on the lateral aspect. It has a sharp anterior border. Like I said, you can feel it in the anterior aspect of your leg. It has a sharp anterior border that faces forward. A sharp anterior border that faces forward. And you see, this is call it the anterior crest. Sharp anterior border that faces forward. Now let's take a look at the upper end of the tibia. The tibia has medial and lateral condyles, like we have stated earlier. They articulate with the femoral condyles. If you have watched the video on osteology of femur, you know we talked about the lateral and medial femoral condyles. Now the medial and lateral condyles of the tibia form a joint with the medial and lateral condyles of the femur respectively. We have the intercondylar eminence, which if you look at this, you see the medial condyle, you see the lateral condyle, and between them is the intercondylar eminence. Look at that space there. It's called the intercondylar eminence. We have a superior articular surface called the tibia plateau. If you look at the upper part, you see these two projecting parts here are called the tibia plateau. Don't mistake the tibia plateau with the intercondylar area or eminence. See the intercondylar area here, somewhere exactly around here, while the plateau is these projecting parts you can see at the upper part. So the fibular facet present on the lateral condyle. If you look at the lateral part of the tibia, you see a fibular facet. Is a point on the tibia where the head of the fibula articulates. This is the fibular condyle. Yes. Now let's look at the tibia tuberosity. The tibia tuberosity, like we mentioned earlier, you already know the tibia tuberosity. you find it here. This is your tibia tuberosity. It is a rough anterior prominence below the condyles. See, it's below the medial and lateral condyles. You find it below. It's a site for attachment of the patellar ligaments that attaches the patella to the tibia. There's a ligament that found at the apex of the patella. We'll talk about the osteology of the patella in one of our videos. So this tibia tuberosity is the site of attachment for the patellar ligament. Now, it's an important landmark in clinical examination. Very, very important. It's an important landmark in clinical examination. We have the Osgood Schlatter may affect this area in adolescent. This is a condition whereby the tibia tuberosity can be affected, can cause inflammation as well as pain, common in adolescents. We have the shaft of the tibia. Now, the shaft of the tibia, it is triangular. Now, take a look at this. This is the shaft. This is the shaft. Can you see that it looks like a triangle? The shaft of the tibia is triangular and it has 3 borders as well as 3 surfaces. See, this is one border here. This is another border. This is another one. Then in terms of surfaces, this is one surface. This is another surface. And this is another surface. So the tibia at the shaft, it has 3 borders and 3 surfaces. The anterior border is subcutaneous. The one I said you should palpate. Subcutaneous and palpable. You can feel it under the skin. You can feel it. This is the anterior border. It is subcutaneous and palpable. After that, we have the medial border, which is also subcutaneous. This is the medial border. It is also what? Subcutaneous. You can see how close this is the skin. You can see how close the anterior border and the medial border are to the skin. So you can palpate them and feel it. While for the posterior surface, it has a solear line that we'll see in another image. But the posterior surface has a solear line. This is the posterior border, which is not the lateral border, sorry. It's not palpable under the skin because it's located deep to the muscles. So now, what are important features about the shaft of the tibia? We have the solear line, which gives attachment to the soleus muscle. We have, this is the solear line, which gives attachment to a muscle called the soleus muscle. We have the nutrient foramen that is directed downwards. The nutrient foramen is directed downwards. We have the interosseous border, which is laterally for interosseous membrane. You know, the tibia is already a bone on the medial aspect of the leg. So on the lateral aspect, it has to form a joint with the fibula, and at the middle aspect, it forms an intermediate joint, which is formed by the interosseous membrane. There's a membrane connecting the tibia to the fibula. So on the lateral aspect, we have the interosseous border of the tibia. It is strong weight bearing function. Yes, it performs a strong weight bearing function. The shaft performs a very strong weight bearing function. So this is the tibia. You have your anterior view, you have your posterior view. See how this tibia crest, anterior crest, is very sharp. You have your solear line, you have your patellar tendon attaching at the tibia tuberosity. Now let's look at the lower end of the tibia. The tibia has a medial malleolus, which we already said earlier. It projects what? Downwards. See how it's projecting downwards. Take this as your normal level. See that the medial malleolus projects downward. We have a fibular notch, which is on this side. This is the fibular notch. Just like we're having a fibular condyle at the upper part where the head of the fibula attaches to. At the lower part of the tibia, we have a fibular notch where the fibular bone will attach to the tibia at the lower part. This fibular notch is laterally and for distal fibular attachment. It is for distal fibular attachment. We have an inferior articular surface for the talus. We have inferior articular surface for the talus. This is an inferior articular surface that is for attachment of the talus. It forms the ankle joint with the fibula and talus. Now when you have your talus here, you have your fibula here, and you have your tibia here, together you form the ankle joint. The lower end of tibia, the lower end of fibula, and the talus together form what? The ankle joint. Ossification. We have primary ossification centers for the shaft, which appears in fetal life. We have secondary ossification centers, which appears at the upper and lower ends. We have at the upper end appears first and fuses last. In the upper end, the ossification centers of the upper end appears first but fuses last. It is important for growth assessment. This knowledge is important for growth assessment because as you look at the tibia, the presence of any center of ossification tells you about the growth. Has the bone is the bone completely developed, or it is still developing? This is the importance of ossification centers. Now let's look at clinical anatomy. Fracture of the shaft. The fracture of the shaft of tibia is common due to its subcutaneous position. I already said that. You feel the tibia, it is subcutaneous. So if anything hits one at the anterior aspect of the tibia or the leg, the tibia is easily going to be fractured. The shaft specifically, because it is in subcutaneous position. The medial malleolus fracture is common in ankle injuries. There could be fracture of the medial malleolus in ankle injuries. Tibia fractures compromise blood supply as well as healing, because it's subcutaneous and it needs blood supply is needed for bone growth. So the tibia fractures may compromise blood supply to the tibia and may also affect healing. Now stress fractures are common in athletes. Talk about stress fractures where due to excessive contraction of muscles that are attached to the tibia, we can have stress fractures. So in summary, the main weight bearing bone in the leg is the tibia. The patellar ligament inserts at the tibial tuberosity, and there are key landmarks in the tibia that you need to know. You need to know the condyles, that's the lateral and the medial condyles. You need to know the tibial tuberosity, which we say is the attachment site for the patellar ligament. You need to know the solear line, which we said is the attachment site for what? The medial solear muscle, while we need to know about the medial malleolus at the lower aspect of the tibia. Now, an important viva question you need to know when you're going for viva and when you're reading your osteology, you need to know about fractures and side determination of the tibia. When you're giving a tibia, you should be able to determine whether it is the right side or left tibia, and fractures of the tibia. Thank you for watching. Make sure to subscribe to Alacrity Explains Anatomy so that you get notified whenever we drop a video. Subscribe and turn on the notification button. Thank you.